We try to offer, as many types of services as possible, but anything that we offer, we want to make sure that we're doing it well. So from a restorative standpoint, it could be something as simple as filling a single small filling in a back tooth, which isn't highly aesthetic, but it's something that needs to be done because they had a cavity. Or some patients would prefer and they want to get rid of some of their older silver fillings. And we find even on silver fillings, probably 60% of the fillings that we take out that visually looked okay, and even looked okay on an x-ray, there's already starting to get some decay underneath those old silver fillings, just because they tend to shrink and they don't seal very well. So it could be anything as simple as a filling, replacing old silver fillings, going from there it can be the bondings, which are used both in the back teeth and in the anteriors. Then if we're doing something that's more extensive, they require large teeth that have large restorations already and either cracked or fractured, placing crowns. In our practice, we do not use crowns that have metal. We got away from that about 7 or 8 years ago. And one of the frustrating things for us was that we could still aesthetically make it look good, but a lot of people tend to be sensitive to metal. And even we would use noble metal versus non-precious, meaning noble metal is better. In other words, you really don't want to put non-precious metal in someone's mouth, which unfortunately is done a lot because it's less expensive. But that has nickel and other things that people can have a reaction to, or the localized tissue. So what happens is you'll have a crown that's inflamed, the tissue's inflamed around it. But we would find even some patients, even when we use noble metal, still had some slight inflammation. And so since we've switched over now, we use non-metal crowns, we have zero inflammation, which is great. I've even gone back and some of these crowns that I used to look at that had metal and inflammation, I said, you know what? I'm just going to change that thing for you. I'm just tired of looking at that inflammation around that crown. And so, and that's part of staying up with the newer technology, because now they have materials that are strong, that provide the core so you can replace the metal, but then you can still layer them with the porcelain, which provides the aesthetics. So you can still get that natural look, that translucency and opalescence, which is important so that it doesn't come out looking like a chiclet. So I always kid my patients when we start talking about cosmetics that if they're looking for someone who does chiclets for them, they need to go see somebody else. So, because I do not want to look at those.